Great. I think people can just mute themselves, other than Nicoletta. And then.
Let me start here. Thank you all for joining us. I'm IEO's Nicoletta Battini, and I'm excited to introduce Kevin Gallagher today, who is one of the most knowledgeable commentators on issues related to fund work. He's going to present a seminar today on tracking the IMF's response to COVID-19. And we're really lucky to have him because he's both an academic and also director of the Global Development Center at Boston University's Pardee School of Global Studies. He also sits on the T20 Task Force on the International Financial Architecture of the G20 and on the Committee for Development Policy at the UN. His recent books include The China Triangle, Latin America's China Boom, and The Future of the Washington Consensus and Ruling Capital, Emerging Markets and the Re-Regulation of Cross-Border Finance. Professor Gallagher will talk for 20-25 minutes. He's going to share his screen in a second, and he has two discussants today. Sanjeev Gupta, who is now at the Center for Global Development after a distinguished career at the IMF in the Fiscal Affairs Department, and David Archer, who's also one of the foremost experts in civil society on the impacts of IMF policies, and he's now with ActionAid. So without further ado, I'll pass the baton to Kevin, and welcome again. We can't hear you, Kevin. You're muted.
Folks can hear me now, yes?
Yes, now, yes. Thank you.
Okay, great. Well, thanks for having me, folks. Thanks, Nicoletta and Prakash, the IO in general, and really extra thanks to Dr. Gupta and David Archer for taking the time to look at some of this work and provide some commentary. I'll talk about a number of things that our center, the Global Development Policy Center, or the GDP Center that we like to call it, is working on, but I'll focus mostly on a new paper with its preliminary results that I did with Franco Maldonado Carlin, who's also on this Zoom call. And we'll try to cut through three things. First, we'll talk about what the IMF's stated goals have been to try to combat the crisis and what they've been able to put together thus far. Number two, we'll talk about how we tried to create a IMF COVID-19 recovery index, which tracks IMF behavior. As part of that, we'll also start a conversation about how to use our index to measure outcomes in the longer run. And we'll talk about next steps for research and next steps for the IMF and the G20. So what has been the IMF response? I think they've really articulated a new vision, but thus far are working with their old balance sheet. As the economist Eileen Grable likes to say, this is not your grandfather's IMF. And especially with the new managing director, Kristalina Georgieva, the IMF immediately has stepped up to be a global thought leader on attacking the virus and responding to this crisis on a global level. You've had some immediate analyses that show that emerging market and developing countries need upwards of $2.5 trillion in immediate liquidity. You saw the managing director call for a new allocation of special drawing rights, echoing what most of the executive directors did. And importantly, in speech after speech, we see the managing director talking about the need to protect the most vulnerable people, to make sure that countries have the fiscal space to attack the virus itself. And something that's relatively new for the IMF and really accelerated under the new managing director is putting a primacy on making sure that we also have the long run in the view of our short term, and that the long run has to have a green recovery as a major component of it. Unfortunately, the IMF hasn't been able to be that bold. In other papers, we have a paper that just came out with World Development with Thomas Stubbs and a number of other colleagues, where we show that unfortunately the IMF hasn't been able to harness new special drawing rights and expand its balance sheet, largely because of two shareholders at the board I'm not going to talk so much about what the IMF has not been able to do, but talk more about what they've been able to do within the confines of their own balance sheet during this talk. So what the IMF has done since March, first and foremost, is mobilized and enhanced the existing resources. It has about $388 billion to work with for emerging market and developing countries. Within that, they actually expanded the quota amount available in rapid facilities. Used to be 50%, now to 100% a year. They activated the CCRT and are on a campaign to try to replenish it. They established a new short-term liquidity line, and of course are really out there on surveillance and advice. We create an IMF COVID recovery index to try to examine the extent to which these programs encourage member states to use IMF resources to gain the fiscal space, to attack the virus, protect the vulnerable, and mount a green recovery. This is a little bit more updated from the paper. If those of you, some of you folks looked at the paper, we had only gone up to about July 31st. Now we've sort of coded and tracked all IMF programs in between March 23rd to September 2nd. What you see here that during that period, we're looking at about 101 programs across 80 countries, a little bit short of $88 billion. However, it should be noted, you can see my cursor here, that that about half of that are flexible credit lines just to 3 countries that haven't been used to date. This just these two figures show the disbursement by amount and also by the percentage of quota. About 90% of the programs are below $1 billion. That's what you can see here on the left. The average disbursement's about $431 million. The largest one within our sample is a $5.2 billion disbursement to Egypt under an SBA. The smallest is $2 million for Sao Tome and Principe that has an ECF. On the right-hand side, the majority of the programs are either RCFs or RFIs, which have a cap of about 100% of the country's quota. The majority of the conditional programs are at less than 100% of quota, 9 of the 13. Yeah, I should have noted that one of the things that is important to note in this one is that of the 101 programs, only 13 of them are conditional. 88 of them are the various rapid and more flexible and unconditional, largely unconditional programs. There are a handful of countries that have programs above 100% of the quota that are either linked to conditional ones or FCLs that we can talk about. So we tried to put together a IMF COVID recovery index that looked at these 101 programs, and we'll be updating this in real time. As a matter of fact, today on our website, we have an interactive real-time database where folks can go look at the aggregate scores for IMF and by country in real time. And I'll share with you how we put it together. And as you see in my subtitle here, we find that within the confines of its balance sheet that the IMF has strongly encouraged health spending and protecting the poor, but has been lacking on a green recovery. So the fund has put together a number of guidances for countries as they prepare their programs and their responses, and for staff on the inside as they're trying to prepare programs and track progress. The Fiscal Affairs Department has put together a number of these guidance notes. We take a close look at 3 of them. One of them is called Managing the Impacts of the Coronavirus Guidance on Health Spending. The other one is on support of firms and households, and the third is on the green recovery. They also have some work on to help guide staff on how to operationalize IMF engagement on social spending during this period. So how did we create an index? We created an index of 0 to 3 for the entire IMF sort of scorecard, but also for each program. For each program, we coded all of the materials related to a particular program with respect to health, support for the vulnerable, and greening the recovery. So all of the materials, look at all the materials for a particular program, come up with a score between 0 and 3 for health, a score between 0 and 3 for supporting the vulnerable, and a score for between 0 and 3 for greening the recovery, and then create a composite. For each program, we do a 0 to 3 for what we call the 3 pillars: health, vulnerable, and green recovery. And to get the composite for that, we just calculate the simple average. To create a full IMF score for each of these pillars, we weight those by the size of the SDR disbursements for each one to be able to get the full IMF scores. So what does it look like inside? Regardless if it's for health, the poor, or green recovery, you'll get a 0 if the country letter of intent doesn't request or address the need to support any of these 3 pillars of the recovery. You're assigned a 1 if the letter of intent requests to address a pillar, but the request isn't highlighted or acknowledged by the IMF and their staff in subsequent reports that go to the board. There's a score of a 2 if the IMF and their staff report highlights, acknowledges, and explicitly endorses that a particular request by a country that mentions one of these pillars as something that they want the fiscal space for. And a country gets or a program gets a 3 if in the staff report the IMF recommends that a pillar be addressed or even conditioned in order to obtain a disbursement. Here's some of the headline results. I underlined the top one, which we feel like is the overall IMF score. It doesn't include the FCLs, which haven't been used. The IMF gets a 1.82, which as a professor, I wouldn't be so happy given that grade, and as a student, I wouldn't be either. But that does mask some good steps in the right direction. The 1.82 is higher because the IMF is doing fairly well with respect to health and supporting the vulnerable. They score with a 2.39 for encouraging health spending and a 2.65, for supporting the vulnerable. What drags the overall score down, no matter how you cut it, is hardly any attention to greening the recovery, putting climate change and in the environment as a core part of the recovery. Something else that I want to point out in this particular graph is that the IMF seems to slightly be more encouraging with programs that are unconditional. You see that the health score is higher and the green recovery score is higher. But on the conditional programs, that's where actually the IMF score is the highest. And so they're really conditioning support for the vulnerable as part of their programs, which is positive in this particular light. This is just looking at the data in a couple different ways by income level and by region. Not a huge amount of variation here, although one thing to note on the top one, for some reason, the IMF score is lower when it comes to the lower income countries in every respect. The composite's lower, encouraging health spending less, encouraging support for the vulnerable less, and really lack of attention to greening the recovery. When you look at the regional distributions, also not too much variation across the different regions. But when it comes to greening the recovery, that's where you do see an average composite score that's a couple times larger than what the average is, and I'll get into that in a second. Excuse me. This is just what the distribution of the coding looks like. The majority of the programs are scored around 1.3, which in most cases are related that they've got a score of 2 in both health and support for the vulnerable, but closer to 0 for a green recovery. This is what the health policy indicator looks like across the distribution. And just to give you some examples of actual programs, the IMF recommended strengthening social safety nets and health in Cameroon, increase spending for health in Bolivia and Ghana, encourage reallocating resources towards health measures in Bolivia and the Dominican Republic, argued for temporary reduction or repeal of customs duties for medical equipment in Gabon, and highlighted increased the need for increased health spending in Afghanistan and Albania, recommended additional expenses for personnel training and medical equipment in Cabo Verde, and really recommended and pointed out the need for fiscal space for preparedness and organization in responding to the virus itself in Cameroon. What the distribution looks like for protecting the vulnerable. Some examples here are they recommended that Cameroon's strengthen its current social safety nets, that Bolivia allocate more resources for the vulnerable, that Comoros put in place some targeted support to families. They recommended that Afghanistan, Armenia, and Albania expand cash transfer measures, that Albania expand and increase unemployment benefits. They recommended that Bangladesh increase wage support for selected industries, and recommended and highlighted the need for food security to be paid attention to in the Bahamas. Excuse me. The greening of the recovery is definitely where the weakness is. If you look at that, if you look at this figure, only 12 programs score above a 0. So the IMF's performance here is really lacking relative to the other two. But to point out some interesting measures, the IMF did recommend that the Bahamas put in place mandatory hurricane insurance policies, recommended that Bangladesh put in support for adaptation and mitigation measures, that Costa Rica raise excise duties on petroleum and diesel, environmental taxes in that same country, and also recommended that Gambia and Nigeria reduce fossil fuel subsidies. So let's think about this index. As we said in the paper, oh, actually, I thought I had, what did I take? Am I missing? Here we go. There are a number of other efforts out there by a number of different institutes and research efforts on how to track the green recovery. There's something called the Energy Policy Tracker. There's something a group called Carbon Brief and Vivid Economics Green Stimulus Indicator. Unfortunately, most of these indicators are just focusing on G20 countries. So it's hard to really match our index with what these have. If any of those folks are out there or the people who fund them are out there in the audience today, I think it would be great to try to extend this kind of analysis throughout all of the developing world so we can really track the green recovery globally. But when we compare in the 3 countries where these other entities have coded green stimuli, there's only 3 countries that really match the ones that we have in our sample. And we find similar results. The Energy Policy Tracker has really highlighted Bangladesh's program. It has some money in there to shift away from fossil fuels and language around that. We find that in our index that they get a 3 out of a 3. The Carbon Brief in their Green Recovery Policy Tracker, they record the removal of oil subsidies and the policy commitment that they've made towards renewable electricity. We find that they get a 2 out of the 3, as the IMF points out inside their program that the elimination of fossil fuel subsidies over time is a good thing. In the case of South Africa, Vivid Economics that has this green stimulus indicator, they also point out the sort of poor green recovery response on the part of the South Africans, same as does the Energy Policy Tracker. And we code it the same way, not knowing about these trackers before we did our own coding. We give South Africa, unfortunately, a 0 out of a possible 3 for a green recovery. So as we say in our paper, this indicator, which we're continuing to develop and continuing to track, is good in its own sense to be able to just track and monitor how these things are going. But as academics and researchers, what we want to be able to do over time is say, hey, to what extent does IMF encouragement of these kinds of things lead to better outcomes? Obviously, we're in the middle of this crisis, and the data availability is relatively weak, and it's not too soon to see some of these outcomes. So I'm just going to show some snapshots of the kinds of things that we're thinking about doing that give us some early ideas. One of the things that we did just for today's presentation is look at which sector, countries that get support from the IMF during the crisis and countries that don't, emerging market and developing countries. And the World Bank's macro poverty outlook has done some new set of projections on what current account balances might look like and fiscal balances might look like into the future. They did these in June, and another wave of Asian ones in September. Not all of it incorporates all of our coding, but the majority of our coding was before June. And interestingly, what we find is that those countries, the 78 countries that are supported by the IMF, are still projected to have a much larger current account deficit than the countries that are not. But interestingly, if you look over on the right, the countries that are supported by the IMF are projected to have a smaller fiscal deficit on average. It's just a simple average that the World Bank does, than the countries that aren't supported. I don't want to make any strong conclusions about any of this. One would do this in an econometric format and control for a whole bunch of other things, and you could read these tables in a number of different ways. What is clear, regardless of our data and the way we've cut this up, is that we should all just recognize that current account balances are here to stay, that are very concerning, and the fiscal space that countries have, if you look over on the right, is also very concerning. And when you look at the two of them together, as David Malpass and many others have pointed out over the past couple of weeks, we're going to have massive fiscal balance that are in the negative, but also big debts to pay internationally, which squeezes the amount of fiscal space that countries are going to have to attack the virus, protect the vulnerable, and mount a green recovery. One thing that we did to try to see, hey, what kind of outcomes has this had on health and social spending? The IMF Fiscal Monitor has put out these interesting indicators on what are called above the line and below and below the line measures. What they call an above the line measure is an additional spending or foregone revenues in health and non-health sectors. And the non-health sectors, at least partially, are related to support for the vulnerable. According to the Fiscal Monitor database, it's for things like in Argentina to one-off transfers to vulnerable people, food distribution, and things like that. So if you just take, unfortunately, there's only there's not a huge sample of developing countries in the IMF Fiscal Monitor that they've tracked on this so far. But interestingly, we have 17 that are supported by IMF and 18 that aren't. And what you can see is that there isn't a huge difference here. There isn't a huge difference in what the total spending as a percentage of GDP has been, nor on health, nor on non-health or social. So again, too early to read this. You could read this in two ways. On one hand, you could say, oh gosh, the IMF programs aren't making any big difference. On the other hand, you could say the IMF programs are getting countries basically to the same level as countries that don't need such a program. Again, too early to tell, but the kinds of rigorous academic work that folks want to do. And during the Q&A, if we have time, I'd love to get other recommendations of different data, different outcomes that folks would be able to use with our index. So quickly, just wrapping up, what are some of our next steps? We're going to update this index in real time. This is the picture on the right here is what our interactive looks like on our webpage that you can go to today. We also have something called the Global Financial Safety Net Tracker, which helps countries understand how much liquidity they have available to them, not only from the IMF, but also from regional financial institutions like the FLAR, Chiang Mai, et cetera. And some of our colleagues that we've been co-authoring this with, some of this stuff have IMF Monitor, which monitors the fiscal consolidation nature of each of the programs that are out there. What we really want to do with this, as I just alluded to, with this indicator is regress this indicator on outcomes. To what extent has the IMF given countries the fiscal space to attack the virus, protect the vulnerable, and mount a green recovery? And we want to move on to a second phase, which codes IMF advice. To what extent did the Article 4 reports and official advice map to these different kinds of outcomes? To go back up to 30,000 feet, what are some next steps for the IMF and the G20? To continue the bold vision that's been laid out by the managing director, what every executive director has been talking about is there's still a massive need for a new allocation of special drawing rights. as becoming more and more evident that there needs to be an expansion of the DSSI to include middle income countries, least developed countries, and especially the climate vulnerable countries in places like the Caribbean. Third, there needs to be significant debt relief in restructuring for EMDs, and the IMF needs to play a better role on that. And most importantly, we really need meaningful participation by the private sector and the credit rating agencies for all of these things to be aligned. And we need monitoring and accountability systems both inside the fund and the G20 and on the outside. I'll stop there. Thanks so much.
Thank you, Kevin. That was very illuminating and great food for thought for our discussion. I would like to call to the microphone Sanjeev Gupta as our first discussant. You have 10 minutes, Sanjeev. Thank you.
Thank you, Nicoletta. My presentation, if somebody can put them up, the slides, that would be much appreciated. It was based on the paper which Kevin had sent earlier. So it did not base on the presentation which Kevin has made now, which is a lot more exhaustive and more detailed. So I hope Kevin will forgive me for being a little bit more difficult in my remarks now. So let me start. Can we go to the next slide, please? Okay, so let me, my remarks are based on my experience at the fund, which was over 30 years, and having worked with some of these issues that you're dealing with, and also now as an outsider who is not constrained in any way to express the views on some of these issues. So one thing that struck me in what the approach does, it equates the IMF staff reports, which are produced by fund economists, with the IMF board guidance. And there are roughly over 30 guidance notes produced in the last 5-6 months. And so one could ask this question, why should they be used to gauge the degree of commitment by the IMF and member countries when they are staff prepared notes? And then, something which Kevin didn't talk about, but the paper talks a lot about that, which is that, that IMF has cut health spending in the past. And this seems to be a totally one-sided summary of the literature and totally ignores some of the work which has been done in the past. And the results which are being cited from my 2018 paper, which was published last week, now 2020, are totally misinterpreted. And misinterpreted in the sense that, what the paper shows is that the conditionality that exists in the IMF programs, which is on the public financial management side, has helped to increase spending on education and health. And just focusing on conditionality, which is putting some restraints, some controls on in the short term on health and education spending, is not that effective. But the improvements in public financial management have a big impact on health and education spending in the programs. And so by presenting the analysis that the paper has, it takes a very one-sided view of where the literature stands. Secondly, it sort of doesn't take into account what is happening in the post-program period. Yeah, thank you. And whether the programs are on track or off track, because if you start distinguishing between those types of programs, you get a very different result. This is something which we are doing now in the context of the IEO evaluation, but unfortunately, the paper won't be available for a while because the paper first has to go through the processes at the fund and discussed at the board. And then I think Prakash sent out a piece 2 days ago, another note which is based on the social protection strategy, which the fund has come out with in 2019. It basically comes up with the view that the thinking in this area has evolved over the years. There was no discrete break between 1 year to the next. Then suddenly the fund woke up and said, we are going to start protecting health spending. We were not doing that in the past. That's not the case. There was an evolution which started in the mid-90s, and there are many papers which explain that, story. Next slide, please. So the other thing is that, the discussion, the scoring that is being done in this exercise is based on to what extent there is a discussion of that measure in the staff reports. But, somebody who has lived through the fund system, there are space limits in how much discussion you can have. So clearly, in many cases, the staff faces choices, and it's possible in some cases they may not have discussed this issue as much as they would have liked to, given the space limits. And Kevin talked a lot about that he wants to look at the outcomes, and I'm a little bit worried about this discussion on outcomes. For example, we are not capturing the quality of spending. I'll give you an example. In Senegal, they doubled the number of families who are eligible for income transfers to 1 million. But there are a number of studies which have come out from Senegal which suggest that the spending is very badly targeted. And then the other issue, the fact that you've raised health spending in the budget doesn't mean that it is being spent. There is enough evidence from a number of countries which shows that the health sector suffers from very poor budget execution. In a number of regions of the world, 20 to 40% of the budget, the health budget, is not executed. Now, the fact that the tracker is saying that spending has gone up doesn't mean that outcomes are going to improve. And then the results can be misleading in this analysis. For example, health spending in Costa Rica and Nigeria. Costa Rica spends 7.3% of GDP, and Nigeria spends 0.5% of GDP, and yet Costa Rica scores 2 and Nigeria scores 3. There is no way the outcomes are going to be better in case of Nigeria, given the spending and the systems that exist. Costa Rica is supposed to have one of the best health systems in the emerging market countries. Next slide. The same kind of issue comes up when one compares Central African Republic, which is a fragile state, with Kyrgyz Republic on social protection. The results are quite misleading. Now, Kyrgyz is a former Soviet Union country. It has extensive social protection systems, whereas CAR has none. CAR has revenue to GDP ratio of under 10%, and Kyrgyz has a much bigger revenue ratio. It has a lot more social protection in there, and yet CAR ends up scoring better than Kyrgyz. So that again seems a bit odd. then there is I take the point which Kevin makes about relatively poor scores on green recovery. But one could ask this question, that if the governments are faced with massive needs for spending, are facing shortfalls in revenue, are they able to focus on the long-term recovery? Maybe one should be looking at this aspect in the second phase when they are really focused on recovery, because now they are still dealing with the crisis. Next slide, please. So what can one do in terms of, I think it's a very useful exercise, but why not make it more granular? For example, separate the PRGT countries from the GRA countries, and then within the PRGT, take out the fragile states. It would avoid the kind of comparisons that I was talking about, that the paper had made. And the other thing is, the MD has emphasized a lot, something which is about the accountability. And this also comes out in the press releases that follow the approval of arrangements for the board. They keep talking about, we need to keep the receipts. In other words, don't go and spend the money, make sure that you spend it well. And I think that aspect, if it is captured, would help supplement the index that is being made. And then one can think of taking some level of existing spending, adjust the numbers for that. And there are some indicators for quality of spending. Nigeria is being talked about here, but in Nigeria, there are now discussions to reverse the increase in fuel prices or removal of energy subsidies. So there is this issue of policy reversals, which is likely to come up as countries move forward. I think these are my reactions. Thank you so much. I enjoyed reading the paper.
Thank you, Sanjeev, for your very thoughtful insights. I would like to move on and pass the baton to David Archer. David.
Thank you very much. And thank you for the paper. Very interesting, but I must say I've been looking at the paper by Kevin Gallagher, but not the actual, as Sanjeev noted, not the presentation. And I also did look at a couple of the other papers shared by Prakash. I mean, I think the bottom line is that we should absolutely welcome a COVID recovery index. I think it's very, very important to track the connection between policy pronouncements and country level practice, something which ActionAid and many others have flagged as a concern over some period. I think it's the three criteria seem to be good ones to highlight: health expenditure, support for the vulnerable, and greening recovery. I think each of those do represent a significant shift, at least in the rhetoric, and the big question is, does that get delivered in practice? Clearly, the failure to shift investments towards a green recovery is the most worrying finding, but I actually want to focus most of my comments in relation to the area of relatively good, where apparently progress has been relatively good in relation to health spending. I do think there has been a shift in the IMF's priority attached to health spending, and I know that Sanjeev raised some question about that, but I do think that it's been quite notable in recent months. And I do think it's fair, as Gallagher notes, that the IMF has curtailed the space for health spending in recent years, perhaps in some contexts unintentionally. And this is something which we've been tracking, looking at the impact on health spending in recent years, and particularly the issue of constraints placed on public sector wage bills in recent years. And the evidence that we collected back in April suggested that 78% of low-income countries were encouraged to freeze or cut their public sector wage bills. And even where there was an intention to protect health spending or health personnel and education personnel, the consequence was often to freeze spending in those sectors, despite the fact that there are desperate shortages of teachers, doctors, nurses, as documented by the World Health Organization. And it's partly because it's so difficult to bring down overall spending on the public sector wage bill without constraining health and education personnel. So, I mean, that's the data that we've been drawing on, and in that sense, a shift in the emphasis from the IMF towards greater priority attached to health spending is very much welcomed. But I do think that there's still questions about what is happening within that prioritization. And it's not very clear to me from the paper of how the index is going to be tracking that, or whether it will actually care about how that money is spent. I mean, if you look at the, in a sense, more detail is provided about the IMF priorities in this area in the 2020 guidance on health spending priorities by the IMF, which focuses very much on things like intensive care beds, the stocks of respirators, personal protective equipment, and other equipment and infrastructure. Actually, it's almost an afterthought that there might also be a requirement to have significant human resources and staffing. And that's sort of echoed in the other document that I looked at, which is the how-to notes, the how to operationalize IMF engagement on social spending during and in the aftermath of COVID. And they, that how-to note talks about these 3 periods from containment to stabilization and recovery. The overwhelming focus again is on the sort of medicine, food and other supplies, and on social protection. And look, these are all important things, but there's almost no reference to the need to look at the need to recruit extra personnel, even in those cases where the World Health Organization has flagged desperate shortages of teachers, of doctors and nurses in relation to health spending. And I think that does represent a serious concern. In fact, I think there's only one brief reference in that how-to note to the hiring of additional personnel. And even in that immediate containment period, it's talked about that we need to look at this in the context of fiscal sustainability. And then when you get to the recovery, recommendation is that countries might need to significantly scale back spending on health services. And that is what we are finding both in ActionAid and in Oxfam International. We're both doing review at the moment of the IMF COVID emergency loans. And that, what we are finding is that there has been some opening up in short-term spending on health, but that the overall trajectory seems to remain largely unchanged, with an expectation of a return to fiscal consolidation within a relatively short period. That goes to the heart of our concerns, that faced with what is surely the biggest health and economic crisis for many generations, the IMF seems to be offering relatively little in the way of new longer term thinking, and that default to fiscal consolidation is there. That research, both by ActionAid and Oxfam, will be published in the next fortnight or so. So whilst I think it's great that they have this COVID recovery index, and I think it gives, and it's nice to see some positive initial results on the intention on health spending, I think the first and most critical question is it too temporary? And that's a question for the index. Over what period of time will the index track this? It does feel as if quite a lot of the detail in the documents has that expectation of a return to fiscal consolidation, and that fiscal consolidation is likely to act as a major constraint on health spending, as it has in the past, even in cases where there's an intention to protect some of that spending. So I think that that's one thing to look at very carefully. I think there's really important lessons to be learned from the previous IEO evaluation of the response to the financial crisis, which suggests, I believe, that the return to fiscal consolidation happened too quickly. And I really hope that we can track what is happening over the period of time. So that's one critical issue. I think the other critical issue to track is how is that money spent? And I sort of agree with Sanjeev that having more spending does not necessarily mean better outcomes, and it does matter what you're looking at, and also how that money is spent. There's a disturbing reports from Transparency International and Global Witness that there has been some misuse of the resources that have been allocated as emergency loans, that some of that money is more difficult to track than other resources, and so corruption might open up. But my biggest concern as to whether or not the emphasis on equipment and infrastructure and less on people is actually going to be a real constraint in terms of making sure that that money is effectively used. There's a limit to what you can do with more equipment if you don't have people on the front line, qualified nurses, qualified doctors, trained professionals and public health professionals able to play this role. And we really need to track what the World Health Organization has been saying for quite some period about shortages in this area. If the new revenue that is, the priority attached to health is not considering people in any serious way, then I think that's a real problem. And I do think it points to a wider problem where too often the public sector workforce is seen sort of almost instinctively as a problem rather than a solution. The starting point is to try to hold down spending on personnel. Even countries with relatively low spending percentage of GDP spent on public sector wages, like Nepal, which spends something just like 3%, is still encouraged to bring that down. Well, the solution is not going to be very simple, and one of the really messy areas in this is that protecting spending on health and even on health personnel could be at the cost of other sectors. And the sector which is perhaps most seriously at risk is education, because it's there will be a shift of priority even in relation to personnel. And it will be assumed, well, you don't need to, at this point, to have more teachers, for example. However, we are seeing a desperate situation in many schools. It's almost impossible for schools to reopen with any modicum of social distancing unless you have more frontline people in the classroom, more teachers and education personnel. So if the cuts, if education ends up squeezed as a result of that priority to health, the unintended consequence might be to exacerbate what's already a very serious crisis of children being unable to go back to school, particularly girls, rising levels of early marriage, early pregnancy, rising levels of child labour, and a lot of other negative effects. One, I think, ought to make sure that by looking at what's happening in health, we don't take our eye off these other sectors. I think more broadly, there is a need to look at the IMF's sort of positioning around public sector wage bills. They are an incredibly blunt instrument, which I think do sometimes have unintended consequences. And of course, we all agree that we would like to cut down bloated bureaucracies, but I don't think many people would see teachers, doctors, nurses, care workers, the vast majority of people on that public sector wage bill as bureaucrats. And I think there is a need to have a shift of thinking. I think there's been perhaps for too long a bit of a groupthink within the IMF in this area. And I think, as part of the COVID review, but an evaluation, but also more broadly, there's some pretty important questions to ask about whether or not IMF guidance pre-COVID left some countries ill-prepared to respond to the COVID health and economic crisis, and whether or not those countries that made greater investments in the public sector workforce have been able to respond more effectively. I think that's a really interesting area to look at. Whether or not the crisis triggered by COVID has led the IMF to reconsider the role of the public sector workforce in the provision of health and other services, whether there is indeed some sort of unconscious bias or groupthink in the IMF around the public sector and the workforce in particular, and whether in fact investing in expanding decent work in the public sector could be crucial not just for achieving the SDGs, but also for stimulating economic growth and stability, which is not the perspective that is normally taken. So I think there are really deep questions which arise from what I think is a really interesting idea around the COVID recovery index, even on the area where relatively good progress seems to have been flagged. I think it is very alarming, the finding that very little has been done to support a green recovery. And, you know, it is, I think, something which has been a concern, as I said at the beginning, for quite a lot of us for quite some time, that there's a mismatch between some of the sort of policy documents and statements, which are often very progressive and some good material coming out of Washington, and what actually happens in practice at the country level. I do wonder whether or not the sort of finding that the IMF is struggling to really make a difference on greening the recovery is linked to that struggle of the difficulty of thinking out of the box, to think of solutions that go beyond past norms and past practices. That, you know, if we're going to invest in a green recovery, you need to be open to a wider level of system change. And if you can't use this COVID moment, the scale of this crisis, this economic and health crisis, to revisit things like how the IMF perceives the role of the public sector and public sector workers, then it's perhaps not surprising that it's also grappling with addressing investments in a green recovery. Thanks very much.
David, thank you so much. This is an excellent discussion. I'll give Kevin a chance to reply shortly, and we're going to move to the Q&A. But first, two things. So I would like to ask in a minute Irene Yakovlev to give us a little of a glimpse of this note that was mentioned several times about how to operationalize IMF engagement in the aftermath of COVID on social spending. She works for SPR. And after her, Matteo Salazar from Vivid Economics, who's going to also give us, you know, an overview of the Green Stimulus Index, which was mentioned by both Kevin and David. That index tells you and tries to quantify the orientation of stimulus measure towards green versus brown measures, and it's widely cited in comments and works that you find around on the green recovery. Before I pass to Irene, I just like to maybe say a couple of things myself, which I think are relevant in making some points here. So the first thing is that, you know, I've been working myself on the green recovery. So I'm still am a little bit on in my own time, and certainly the topics that Kevin discussed, the health, the vulnerable support, and the green recovery are on the radar screen of the fund. I think that's beyond doubt at the moment, and much more so even in the recent past, I would say. That's a personal view. But the fund has, there's a long road ahead. The fund is doing a catching up game with the sisters agencies in the UN family, which are very much ahead in a number of topics. Think about the United Nations Environmental Program, the WHO, the WFP, the IFAD. They're all positioned to the frontiers of the debates. And the fund, unfortunately, has a higher bar of trying to translate, some of the scientific targets or some of the structural ideas that these institutions are working on into economic policies and structural reform. And that's not an easy task. And what that brings me to the second point, which is, I think fund staff will have to cross the bridge and invest into education about, the science and this, the nitty-gritty of some of these structural reforms. There's a lot of detail to absorb. I mean, the fund is not the OECD, and is not the UNEP, but it needs to do it all at the same time. It needs to juggle all these kind of disciplines in its own hand. I also want to make a last point, which I think is important. I know there are phases in the recovery, and now we're very much still some dispersion into the emergency phase because we don't have a vaccine. But it's also true that Kevin's 3 pillars are very much interrelated. We saw in this pandemic, the health, income vulnerability and poverty, and being exposed to food issues and affordability, and then climate issues are intimately related, and it will be even more so as years go by. This is not going away. This is getting worse unless we manage to fix the problem. So with that in mind, let me just call in Irene Yakovlev, who's I can see in the video. And maybe she can tell us a couple of minutes, a little bit more about that note on social spending and the advices to fund stuff. Thank you, Irene.
Absolutely. Thank you, Nicoletta. It's really a pleasure to be with all of you here today. I'm just going to say a couple of things quickly about the fund's approach to its engagement on social spending, and also in the context of COVID-19. So picking up a little bit on what Sanjeev mentioned, in 2019, we launched a strategy for IMF engagement on social spending. And this strategy was not really a discrete event. It was the culmination of a recognition of decades of increased engagement on social spending, both in our surveillance and in our program context, and also following up to an Internal Evaluation Office report on IMF and social protection that really provided some important lessons that we could build on. The strategy was viewed as something that was needed to guide staff. We wanted to ensure consistency and even-handedness in our policy advice. For example, when we undertook writing the strategy, we learned that 80% of mission chiefs already considered social spending to be macro-critical and were discussing it with country authorities. But there hadn't really been systemic fund-wide guidance on this. The strategy was approved by our board on May 2nd, 2019. It's available on our website with a series of background papers and case studies that benefited from excellent support from lots of external stakeholders. David knows this, and lots of input, which we really appreciated. One thing that I wanted to underscore is that the strategy really, as with all good IMF work, anchored our engagement into our core mandate and what the IMF is for, right? So in order to engage on social spending, we argued that countries and country teams in particular really needed to take into account what was the channel through which social spending was becoming macro-critical or relevant in their country. And we identified 3 channels. In the context of COVID, as in all times, we see that all 3 channels are actually important and relevant, but the relative importance of these channels changes over time by country and with circumstances. So in the initial phases of COVID, obviously the scramble was to ensure adequacy, right? That social spending, as we define it, which is both health, education, and social protection, and includes wages and salaries of workers in those sectors, was adequate to support the poor and vulnerable in these economies. For some countries, this also meant, given limited fiscal space, finding a more efficient use for their existing resources. And as we look ahead to the medium term for other countries, the idea that new programs or new entitlements that came about because of the crisis will need to be sustainably financed, both during the recovery and beyond, is not trivial. And they'll have to work to protect some of the very important gains and priority spending that they've identified during the COVID crisis. So to give you a concrete mapping of how we're telling our countries to approach this, it's pretty detailed and yet highly flexible. And I think this is what we really wanted to underscore. We have available on our website a note on how to operationalize IMF engagement and social spending during and after the crisis. And this really dovetails with also an internal strategy that we have on lending during COVID. And the idea is that with the onset of the COVID-19 crisis, social spending is now really at the forefront of all our country work, I think very much as Kevin recognized. The approach to social spending issues differs, and will differ over the various stages of this crisis, which is far from over. But it's also important to recognize it varies depending on country-specific factors and circumstances. And this really always gives me some pause when people try to quantify what the IMF has done on social spending across our full membership. Because on the ground, when you work with these countries in a program or in a surveillance context, and you talk about social spending, there's a lot of nuance and subtlety that really is driven by the country's priorities, social goals, and what they want to do, and certainly also on our advice. The duration of each of these phases, containment, stabilization, and recovery, is going to vary by country. And so for this reason, we're encouraging all our country teams to really use their judgment and their flexibility when they approach social spending issues, while at the same time underscoring the importance of engaging on these issues in virtually all our member countries. Our current priorities now, as we stand 6 months into this crisis, are really to help our country teams continue to protect population health, provide lifeline support to households that are still affected, and to protect employment during the crisis. Going forward, the emphasis will be on strengthening health systems further, including where necessary by reallocating resources to health services that will be required to deliver life-saving coronavirus treatments and vaccines when they become available. So, for example, in a lot of our countries, in the initial containment phase, resources were shifted to big hospital centers where they could ramp up critical care capacity. But as we think of a stabilization and sort of this wait and see game for a global vaccine, we need to think about whether we have enough staff, as David mentioned, but also resources in urgent care centers, in rural and primary health centers to deliver those treatments and vaccines once they become available. In addition, we're encouraging our teams to promote support for households and workers that's focused on protecting their livelihoods, promoting employment during the recovery, and facilitating a return to normalcy, which critically will involve delivery of education, again, as David mentioned. So I just wanted to give you this overview. The note is available on the website. We always really welcome comments from all sorts of stakeholders. Our emails are there as well. And thank you so much for helping us think about this. I think it's always helpful to be challenged and listen to outside perspectives, because this really is a continuous process for us as we strive to engage better and do this better on sort of we're trying to walk the walk and not just talk the talk on social spending. So thank you very much.
Thank you, Irene. That was very useful. I think it was illuminating the work that is going behind stage on these topics, and the fact also that you're open to debate it on an ongoing basis. Now I saw Matteo is online, so if you want to switch on your video, you have to, but if you wish, we can see you, and I'd like to give you the microphone to tell us a few things about this index on the greenness of stimuli. Matteo, are you there?
I am, yes, I am. Can you hear me and see me? Okay.
Very well, very well. Go ahead, thanks.
Okay, fantastic, great. Thanks a lot, and thanks everyone. Very interesting insights. I'll be very brief. I just shared through the chat the link to the report of the latest Green Stimulus Index report, and as Kevin mentioned, we are guilty of focusing on the G20 countries, but it's definitely on our radar to start expanding the coverage of the Green Stimulus Index to other countries. Right now, we're working on a couple countries in North Africa, another country, the 8 Arctic countries, and and a few more in East Asia. So we will be publishing that in due course. I guess the story behind the Green Stimulus Index goes back to when lockdown started, and we were asked by governments on exactly what other countries were doing, because a lot of ministers of environment felt that they were being left aside in how stimulus were being spent, and they were asking us for help and advice on telling them what makes sense to stimulate the economy, but also help the environment either through climate change or the conservation of nature in general. And that's exactly what we started thinking about, and that's basically the spirit of the Green Stimulus Index, to be able to show on a very simple way what countries are doing and also what countries are not doing. So the methodology of the Green Stimulus Index is really simple. It just takes a number of archetype investments, ranks them according to how green or not green those investments are, multiplies that by how much each country is doing of each of those investments, and scores them on a score from minus 100, that's the worst score or the least or the environmental unfriendly score, to 100. And just for you to if I can get your attention to page number 4 of the report I shared with you on the chat. It's a visualization of how we visualize those results. And we can see that Turkey, Saudi Arabia, China, Russia have the lowest scores, perhaps unsurprisingly. And the European countries, as well as South Korea, have the highest scores. And then we have this sort of weird outlier that is the European Commission. But we thought it was an interesting example of good practice and a set of many archetypes that could set an example for other countries on how to stimulate the economy on an environmental friendly way. So we decided to include it. Yeah, again, if you have any questions or if you want to discuss this further, or if you are interested in the methodology, just call me or send me an email. I'll be happy to jump into a call and discuss all aspects of it. Thanks a lot.
Thank you, Matteo. And indeed, it's a very good report. I mean, I've used it myself, I must say, and I encourage everyone to take a deep look. I would like to give Kevin the opportunity to, a few minutes to reply to the main comments by the discussants. There are 3 or 4 questions in the chat. Let's see if we have to stay within the 1:45 ideally. So if we have time, then we can take those questions. They're quite pointed, so you can answer them if you've seen them in your remarks, or if not, just say what you feel is most important at this moment. Thank you.
Great,
We'll wrap at 1:45 sharp. Thank you.
Okay, great. Let me just take a quick look at some of these chats. I didn't see them. Hey, well, great discussion. That's what we meant to kick off. Let me just reply and respond to some of this stuff. I think the most important thing to sort of underscore and reply to is the comment that David Archer made, which is that a return to fiscal consolidation would be not only a mistake, but really dangerous for the world economy and our broader goals. And unfortunately, when we didn't code for this in it, but a lot of the programs do say that that this fiscal space should be will likely to be short-lived. And I was on a panel last week with the first deputy managing director, and is also already starting to hear him make this "keep the receipts" kind of buzzwords. And it would be dangerous to move into a period of austerity at all, and especially too soon. It flies in the face of some of the great work that Olivier Blanchard did while he was at the fund with Jonathan Ostry, which was in a number of the WEOs about a decade ago. Let's hope that the fund has learned some of those lessons. And the other key component to that is that the IMF balance sheet, the way it is it leaves you with no other way out except for that. And we can't accept the status quo. We can't accept the failure of multilateralism that 1 or 2 countries is putting on the global system right now. We absolutely need an expansion of at least $1 trillion in special drawing rights. We need actual debt relief and it was great to see that the G7 called for that last week. We need restructuring, and we needed the IMF to be at the center of that. And so if we get those two things, there's obviously a lot more fiscal space to be worked with, and a lot more breathing room for the IMF to use with its balance sheet. If we're not having a strong and robust counter-cyclical recovery that puts a green and inclusiveness and health at the center of it, not only are we going to miss our stated goals of sustainable development in Paris, but we're going to make the world much more susceptible to the kinds of climate shocks that right now are affecting small island states in the Caribbean and even the United States here. Some other much more specific sort of comments and replies to on the paper and the work that we're doing. I apologize to Dr. Gupta. I think he got a little confused on what we were trying to do, and I take that as our fault for being unclear in the presentation and in the writing. First, so we focused on attacking the virus, protecting the vulnerable, and a green recovery, because those are the three pillars that were outlined in many of the early April speeches by Kristalina Georgieva, which we also think, and much of the expert constituency thinks, that those are the three core things, recognizing, of course, they're all interrelated. And we are only measuring, the IMF COVID Recovery Index only measures the IMF response, meaning what's in the program. Does the program encourage or require that countries focus on health, focus on the vulnerable, and focus on a green recovery? Of course, interesting to hear from Maureen and others that obviously there's so much space that you can only deal with a little bit. But in some of them, we find lots of variation where there's lots of attention to these things, and some that there isn't. But I need to be very, very clear, and we'll be more clear about this moving forward. The IMF Recovery Index is just a gauge of what IMF encouragement and requirement is within the programs. It seems like Dr. Gupta was also sort of muddling that with outcomes. And actually, we tried to be clear about that in the paper and in the presentation, is that we hope that the indicator can be used as an independent variable to look at outcomes. And I had some experiments at the end there of some things that you might try to look at. I encourage Matteo and Vivid to get more expansive so that one could say, hey, when the IMF recommends green stimulus, does that correlate with a better green stimulus indicator from Vivid? It'd be great to see that. A lot of these other indicators that we played with in the presentation that the World Bank and the Fiscal Monitor have are the kinds of things that you could use as what we call dependent variables. And of course, things like institutional quality, et cetera, are things that academically we control for those in an econometric environment. And so we're not, we wouldn't just say that increased spending might have something to do with this outcome. In that kind of a statistical environment, we control for it. So I'm sorry if I was unclear about that. The only thing I would push back on is on our take on the literature. If you look at the literature on this issue, the overwhelming evidence is that IMF programs have been associated with reductions not only in social spending but in social outcomes. We do. There are a couple papers written by Dr. Gupta that we actually cite in the paper. We didn't know about the new one that just got published. We published this one earlier in the summer that do come to different outcomes for very, very plausible and intuitive reasons that he's backed up with statistics. And we mentioned that as good academics, but that's not a picture of what the whole literature going back to Axel Dreher and Strom Thacker in the 1990s all the way up to Thomas Stubbs and Alexandra Kentakola-Kennis in the past couple of years. It's none of this stuff is fully conclusive, but we did a good job of representing the broad literature on this. The other thing where I definitely want to agree with Dr. Gupta on is that whether it be staff reports or staff guidance notes, these are not the kinds of things that can really change the IMF and make the IMF bake these things in. It's great that there's great vision from the top and many of the executive directors as well. But what it takes is something more analogous to the IMF change on capital account liberalization. In 2012, you need an internal strategy. You need an institutional view that is voted on by the board. You need a staff guidance note. You need to train staff. You need to change the culture and so forth. One of the questions in the chat is, well, what's it going to take for the IMF to start really thinking comprehensively on climate change. I'll just end on that. It's really three things that need to be the core component of IMF moving forward on climate change. The central banks in the world have really gotten onto the forefront on this, and the IMF has been slow, but I think there's real momentum now, and we all know that that you're starting to take this up seriously. So on number one, and on the surveillance, IMF surveillance is going to have to look at physical and transitional risk within countries. To what extent might physical risk, say, or climate risk, say, hurricanes in the Caribbean, how will that impact financial stability? And how will that affect the public purse or the public financial stability? Same thing with transition risk. When a country, if a new government comes in and decides to be ambitious on climate change, well, what will that do to the financial system? How will that change some of the fiscal systems? And spillovers related to that. To what extent, if your neighbor, or if the United States, or if some other country makes a major transition, how might that affect a country's financial stability and fiscal stability? Second, on advice, the IMF is going to need to learn how to help countries design policies to make their fiscal and financial systems more resilient, whether it be macroprudential policies like stress testing or microprudential policies like mortgage rules that make you have strong roofs in the Caribbean. And he will be IMF advice on how to design stimulus packages, green recovery packages that help meet these goals. And finally, the third part is program design, that programs can't be a step back with fiscal consolidation, with going back to privatizing, gain money, gain immediate resources through new oil concessions or turning on the lights on new coal plants, is that each program, country program, whether it be conditional or unconditional, is going to have to play a key role in the transition. But it has to make it a just transition. I think one big lesson of the programs that the IMF was engaged with in 2019, where if you just looked at it through a climate change lens, you'd say, oh, it's good that in Haiti and Ecuador, there was a reduction in fossil fuel subsidies, but those fossil fuel subsidy cuts were all about the fuel that are used by the very poor. And so these programs really instigated massive riots in Haiti and Ecuador. In Ecuador, that was so bad they had to move the capital. And that turns into yellow vesting of the global South. And right at the moment where we need a concerted effort about climate change. So not only do we need to get the policies right, but we have to make sure that the vulnerable are protected throughout the transition period. So lots of work for the IMF to be doing on this, but the finance ministries and the central banks are really out ahead. And since they're big shareholders of the IMF, I think the IMF can get up to speed right when we need them to. Thank you.
Kevin, thank you so much. Your work is stimulating. It's definitely a make it or break it moment for the fund and the global economy. And unfortunately, failure is not an option. I would like to thank David and Sanjeev for their very thoughtful remarks, and everybody online. We will circulate the paper by Kevin by email, and if people want to bring up their questions to Kevin directly, we can facilitate contact, although his email will be on the paper. Thank you everybody so much, and have a great day.